Hi everyone, my name is Melina. I'm Jessie Daquilla's oldest daughter. And I'm going to go ahead and do this video that I've been putting off for a little while now, but on behalf of my mom, because I know that she would want all her close friends and family to understand this journey that she's going down. It's all still pretty new for her as well as us, so if you call or text and we don't get back right away or things like that, please understand that it's just there's an abundance of people that have been reaching out, and my mom she feels that love. She really does, but sometimes it's like hard for her to talk because her oxygen levels can drop down, or my dad, we're all still working and stuff and just trying to get my mom past this season. But if we don't respond back to you, please know we see your messages, and we are really thankful for each and every one of you, and that we love all of you guys. And that's kind of why I'm going to go ahead and do this. I asked my dad if he thought maybe he could just do a video with me explaining it, and he was like, "Honey, I can't. I just can't." I mean, he can't really talk about it without breaking down too much. So I'm going to try to give you as much information as I have at this moment, and maybe post things in this group, just so you guys can kind of understand what's going on with my mom and where she's at. And if that's, what I could do to help them, then that's what I'll do. So for those that don't remember, or maybe were unfamiliar with how bad it was in 2021 around this time, it was like October, November, and December, my mom got COVID really, really bad. And she was in the hospital during that time. She ended up with double pneumonia. She had all three types: viral, bacterial, fungal. And they aggressively treated it with antibiotics, antifungals, and the main thing was the high flow continuous oxygen. And what that was like your typical nasal cannula that you see. That wasn't cutting it. My mom had to have so much more, to the point where they brought in this big machine, and it just pumped this insane amount of oxygen into her using like a thicker tubing style nasal cannula. And then when that wasn't enough, they switched it to like a BiPAP, CPAP style mask that completely covered her nose and mouth, and just that oxygen went into her continuously for 3 months. And that, while it kept her alive, so say, it caused some very serious permanent lung fibrosis, which is scarring, that you can't change it, you can't soften it, you can't do any of that apparently. It's just kind of something that she knew she was going to have to deal with, but we just didn't really understand to what extent. So back in March of 2022, she went back to work, and she continued to work and just do daily life with this new normal that she had. And what this new normal looked like was she had chronic coughing fits and hacking and shortness of breath, and really and truly she should have never went back to work. But I mean, we didn't know anything about this. Nobody came up and said, "Hey, you have a major disability," or anything. The doctors were just telling us like, this is what has happened. They kind of were giving hope, saying, over time it will get better. Well, it didn't. If anything, it got worse. So fast forward to this year, January 2025. My mom ended up with flu A. She tested positive for the flu, and she was hospitalized for about 2 days during that time because her oxygen levels got down. She got real short of breath. She was getting nervous that, is this the pneumonia coming on again due to this viral infection I have? So she told my dad, take me to the hospital. She was so traumatized as to what happened before. She doesn't ever want to go through that again. So she goes to the hospital, and when they get there, they basically tell her, oh, well, you're positive for flu A, which we all already knew because not only was my mom positive, I was positive, and I was 39 weeks pregnant. My husband was, my daughter was. So we all ended up having it. And that really was my mom's drive to get out of the hospital during that time. She was adamant that she was going to be in the delivery room with me when I had my daughter. And I was super terrified that, I was going to go into labor at any given minute, and we didn't have anybody there without the flu other than my dad. So she was just really pressuring them at the hospital, telling them, listen, I need to be well enough to get out of here and get back to my daughter. So luckily they were able to get her out of there within 2 days, but they did send her home with supplemental oxygen, which was a new thing too, because like my mom for all these years, the only time we ever saw her on supplemental oxygen was when she first came home in 2021 with the COVID, and she didn't use it for very long after coming home. So that was pretty new, but when my mom got up to Nashville to stay with me, we stayed there for 2 weeks because I went a little bit over. She was using the oxygen a little bit, but then we were trying to think of things to, come up and get this baby moving and going and everything. So I would say, Mom, let's go for a walk. And my mom could do those things. Like her and I would go to the mall on a Tuesday night and walk around the mall together. Now she was slow, but it wasn't anything like what we're seeing now. We would have never thought that then. We just thought, okay, she just got over flu A, like she's just recovering. So by the time I had my baby, which was January 22nd this year, my mom was not on oxygen or anything like that. She was in the room with me. Everything was fine and okay. After that, I was out on maternity leave till the beginning of May, and I saw my mom pretty frequently, probably every other day, if not every day. And nothing super alarming to me other than she did still have the chronic cough, the hack, which has been continuous for years. And anytime she went to the doctor, they would say, you have, your scans they don't differ very much from now to back when you got out of the hospital in 2021. So we thought, okay, nothing is progressive, because my mom doesn't have any genetic dispositions or anything like that. It's just all of this was caused by COVID pneumonia that she got so severe. So in May 2025, I went back to work and my mom actually retired. And within a couple weeks of me being back to work and my mom being retired, I just remember seeing a major decline in her health. And this decline I'm talking about is like she had this major weight loss. She was struggling with her oxygen levels. She needed like an increased need of supplemental oxygen. I started noticing every time I was going by, she had the oxygen on. And I was like, Mom, what's going on? Is something up? And she was like, oh, I think I just got sick and I'm just struggling a little bit. So she kind of pushed it off to like seasonal allergies, like the flowers were blooming and all the pollen was really high here in Tennessee. So like I said, that was in May. And shortly after that, still in the May, early June time frame of this year, my mom's sister Weiss was at the house. Some people know her as Toot or Tootie. And her and my mom were planning on taking a trip to their brother's house in Arizona in September. They were talking about that and just everything. And my aunt was kind of, looking at my mom and just evaluating her, I guess, mentally, like not saying anything, but just kind of watching the things she did and how she was reacting and stuff and her cough. And me and my aunt went outside and we were standing in the driveway and I told my aunt, I said, I'm really concerned about my mom. Like, she doesn't look well to me. Something is not right. I was like, she's losing so much weight. it seems like she's coughing all the time, like even worse. And she agreed, and she said, well, I told you about this last summer, that I was having concerns when your mom and I took a trip to the beach to meet you guys, and they had rode down together, and my aunt was really concerned about how bad my mom was coughing and how bad she seemed to be struggling. And I said, oh, well, that she's been doing that for years. And my aunt said, well, I don't care. That's not normal. Like, I want her to get in with a doctor and see if there's a type of medication or a therapy or something that can help, ease or break up this fibrosis or what, something. Neither my aunt nor I are doctors or pulmonologists, anything like that. So we didn't know the answers. We're just sitting out there discussing this. And I was very uneasy, and I told her, I said, Aunt Toot, is my mom going to die? Do you think my mom is going to die? And she, obviously she doesn't know the answer to that. She's not God. But the way she responded to me let me know that she was nervous and unsure, because she said, we're all going to die someday, which is the truth. But she said, this is why I went ahead and have been urging your mom. I want her to go and, get this looked at, get this taken care of, see what there is that can be done, because I want her to live the rest of her life enjoying her life. And she said, this is why I'm wanting to take that trip. And she said, we don't know that answer, but we need to enjoy the time we have people here. And like I said, I was crying, I was upset, and we went back in. We didn't discuss it anymore because my mom could tell I was upset. So, my mom actually had made an appointment to see a local pulmonologist in July of 2026. His name is Dr. Carruth. And she was just going to go see him to see what kind of therapies or what he could offer her to treat these symptoms she was having and maybe get her back to some kind of better quality of life. So, but what my mom did not know was after the appointment, prior to this appointment, after the conversation that I had with my aunt, I went ahead and I had called Vanderbilt Lung. And I asked them, can you get my mom an appointment? She's really sick. I'm calling on her behalf. She doesn't even know I'm calling, but she needs help because she's very, very sick. And they were like, let us look at the schedule. They pulled it up and they told me, yes, we can see her, but our soonest availability is March of 2026. And I was like, that's nearly a year away. That's not going to work. She was like, I understand, and I'm so sorry, but that's just where it's at. That's how far along we are. Like, that's how far out we are. There's nothing we can do. And while I understand, there are many people who are sick and need care and help, and not trying to say like my mom needed it more than them, but really in that moment she did. So I went ahead and actually stayed on this phone with this receptionist, and I did not catch her name or who she was. I just know she works for Vanderbilt, and thank God for her, because I began to cry, not just because I was so emotional and broke down at that point. Like this can't just be, I can't just settle with my mom going to this appointment in March. Like, that's just not going to work. And I explained to her, I said, ma'am, I know you probably get calls every day, people saying they're very sick, and I understand that. And I'm not trying to make it sound like my mom deserves an appointment before somebody else or anything like that. I was like, but I do work in healthcare, and I promise you, my mother is very sick. Can somebody please see her sooner? Like, I don't care where the location is. We will go wherever. And she said, well, do you have time? And I said, yes, I have 2 hours that I can talk to you. I was on my way to Nashville. And she said, okay, well, if you'll stay on the phone, I'll look and see what I can do. So she looked literally for almost 2 hours. And she told me that while we were on the phone, somebody had called in, canceled their appointment, and there was availability that opened up for September of this year. So even though it was going to be a couple months away, I wasn't willing to say, no, we won't take that. I was like, that's fine. Put her name down and I will call every single week and see if there's a cancellation. And that is what I did. I called every single week and there wasn't one. But she did have the appointment scheduled for September with Vanderbilt. So in the meantime, July rolls around of this year and my mom goes to see Dr. Caruth, and he prescribes her new medication. He prescribes her to do pulmonary rehab twice a week. And he tells her, I'm very concerned with what I'm seeing. Your lung function seems to be very low. To give you guys a mindset of what my mom has been dealing with, they told her the average female their lungs have a capacity of about 3 liters, and my mom's has been functioning at less than 1 liter. So that's very significant. And he told her that he was going to refer her to Vanderbilt. And she said, well, my daughter actually already got me an appointment and I'm going there in September. And he was like, that is wonderful, because he didn't know how soon she would be able to get in, because he knew, they stay booked up like that. So my mom had an appointment, I believe it was September 30th of this year, and she went to Vanderbilt Lung, and they referred her to the transplant center after testing her lung function. They felt that it was incredibly low as well, and told her, we think you're going to be a candidate for a lung transplant. We think that this is the point where we're at, which was super shocking to us. It was very emotional. What? We're not expecting that. We thought she was going to go to the Lung Institute and they were going to tell her, we have this medication or we have this therapy or something. We definitely were not expecting that news. So, I do travel ultrasound, and a lot of my patients are in Nashville. And that day I happened to be working in Nashville. And I called my mom and dad. I knew my mom was getting out of the appointment. And I said to her, Mom, what did they say to you? She was hesitant, and she said, they think I need a lung transplant, a double lung transplant. And at that moment, I got really silent, because anybody with any healthcare background knows that, any type of transplant is serious, but a lung transplant, that's a lot. And that was not the news that I was looking for. So they could tell I was really upset. And my parents were like, well, where are you at? And I told them, I said, I'm actually just the street over from y'all. I've got to go see this patient. And then I'm going to head back to Paris. And they said, well, we'll stop and see you really quick. So they pulled over next to me, and I got out of the car and I was talking to them, and I just started crying, because I started talking about everything. Your mind just starts going everywhere. You think of the risk of rejection. You think of the life expectancy, or you do what everybody does, and you start Googling stuff, and it's not good to do that. Because if you Google it, it tells you people only live 5 to 7 years or 10 years, and, just things you don't necessarily want to read. So getting that information and getting all this at once just really was a lot. So while I'm sitting there talking to my mom and everything, she says, honey, I'm going to be okay. God's got me. And that's the one thing. My mom has been so faithful throughout all of this. But she tells me, he didn't bring me this far to give up on me now. So I said, okay. And they said, you just, you gotta trust in him. You gotta have faith. And I'm trying to be strong and think, okay, yeah, they're right. This is if they say this is what she needs, this is what she needs. And I've got to trust that, God's got his hand over this. So I try to dry my eyes the best I can and get back in the car and leave and pull over to my patient's facility. And I am still sitting in the car trying to get out, but my eyes are all watery and raw, and you can just tell I've been crying, and I'm trying to get myself in the shape to go in to see my patient so that they don't think, what is wrong with her. So I go in the facility and I see my patient and I collect their paperwork. And a lot of the times, I have to, not a lot of times, all the time, I have to collect their billing information and their face sheets. And so I grabbed this patient's face sheet and I walk in their room and I introduced myself to them and I flipped over to their face sheet. And a face sheet has all the diagnoses that a patient has. And the very first diagnosis I have not seen on any patient that I have ever done in over a decade. And that diagnosis was lung transplant. And so I kept it together because I think I was just kind of shocked. And I looked at my patient and I said, "Have you had a lung transplant?" And they looked back at me and they said, "Yes, I have." And I was like, "Oh." And I asked them, I said, "How long ago?" Because I had just spent 5 minutes prior to this whole situation of walking in and seeing this person. I was just talking to my mom and dad out in the parking lot, crying my eyes out because my mom got told she was going to have a lung transplant. And I'm sitting there thinking, 1, is she going to survive it? And 2, is she only going to survive 5 to 7 years after this? Because that's what we had just read. And that patient looked back at me and they said, "I had it 35 years ago and it was done at Vanderbilt." And I busted out crying. And I tried to control myself the best I could. And my patient grabbed my hand and said, "Honey, are you the donor's family?" And I shook my head no. And when I brought myself to it and gathered myself and apologized and wiped my tears, I said, "I'm so sorry." I said, "I just was outside crying my eyes out to my mom and dad because my mother was just told she has to have a double lung transplant. And then I walk in and I meet you." And this patient told me, they said, "I want you to stop what you're doing right now. And if it's okay with you, I'd like for you to call your mom." So I went ahead and I called my mom and I was crying and I said, "Mom," and my dad was in the car too. I was going over their speaker. I said, "I want you to hear what has just happened to me." And my mom got on the phone with this patient and they talked. And this patient told her that everything that she went through and how good life was after this. And don't read things on the internet, talk to people. And also that they used to go to the lung transplant center and talk to other people to encourage them. But because of HIPAA laws, they had to stop that. So my dad said, "Honey, that's just the way God works. We're going through this right now. And that's the first person you see after we get this information. You have to know that God has his hand on this." And I thought, my God, that has to be true because I've never experienced anything like this. So my mom exchanged information with this patient, and actually they have kept in contact with one another. This person has been incredibly encouraging to my mom. And just, since starting this journey, we have reached out. We have had so many people reach out who have said, You know, I know somebody from here who has a friend of a friend of a cousin of a aunt, other friend that is had a double lung transplant, and I can get you in contact with them. And it's, my mom has talked to a man from California who had he didn't have COVID. He had a double lung transplant 14 years ago due to cystic fibrosis, and he runs every day now. My mom has talked to a 36-year-old who had pulmonary hypertension. She had it about 3 years ago, I believe. She said she lives basically a normal life. My sister Valerie got my mom in connection through a friend at college who had a friend. And this woman is around my mom's age, and she had a double lung transplant. And when my mom talked to her, she was wrestling in the floor with her 5-year-old grandchild. Like, we have been given so much hope through this journey from other people. And that is where my mom's hope has come from. Like, that and God, of course. But just hearing those stories and stuff has really, really, really been encouraging to her. So, in October of 2025, this year, my mom went to the transplant center, and they tell her that they are proceeding with doing testing, clearance testing, and they give her a timeline. They basically break down how this is going to be. And this is going to be a long, rough journey. They were very upfront and very honest about it. So the first step is that my mom is getting this testing clearance. She is in Vanderbilt right now. She's staying in Nashville. Her and my dad are actually in a hotel for the next 11 days while my mom does all these clearance tests she has to have. I spoke to my dad this morning, and my mom had, I believe, 43 tubes of blood drawn, that they had to make sure the blood was, that all her labs are normal. I think they test for some genetic things, and I did get word back that those all were in normal range and came back negative for anything bad. So that is a good sign. Next, she's doing like another pulmonary lung function 6-minute walking test. She has to have all kinds of telehealth counseling meetings, all this. She has to have a colonoscopy, a heart cath. They require that you have a mammogram, a CT of your abdomen, your pelvis. I'm trying to think what all that. It's just, they had to FedEx an itinerary. It's so much. Like I said, they call it Hell Week because you have to do all this testing. Once all this testing is done and she's cleared, they will meet on a Friday, all the surgeons that perform this, the lung transplant surgeons. And they decide, yes, this patient is strong enough, they can survive the surgery, they're a good match, they're a good fit, and we think they would be a good candidate. At that point, they will put my mom on the national registry. And they told her to expect between a week to 2 weeks once you go on that registry to get the call that they found your donor. So once you get your donor match, she has to be at the hospital within 6 hours. And that is for them to start the surgery. Once they find a donor, basically what happens is Vanderbilt has a donor team. They load up on a plane and go wherever this donor may be. They assess the lungs, pack them, fly them back. Once they get them to Vanderbilt, they will put them on what's called a lung pump. And I believe they can only leave them on that pump maybe 12 hours. And so, like I said, this is just going to be very emotional, because as prepared as you want to be, you're not prepared, because they just are going to give the call at any given time. Like, there is no notice. So after she gets the surgery, and God willing, everything is successful, no rejection, she will be in ICU, I think for a week, maybe. And then after that, she'll be moved down from ICU, and she'll have to remain in the hospital for approximately a month, I believe. And then from that point, my dad and my mom have to live in Nashville for 3 months. My mom's sister is also going to be there to help my mom, because they require that there be a minimum of 2 caregivers 24 hours around the clock. So it's a whole lot at once. It's basically everything that we know right now and the information we have. And, we just want everybody to know what's going on. And if you all will please just continue to pray for my mom. If you know my mom, you know how full of life she is. And the last 6 months have been really hard on her. I don't know if many of you have been able to see her or not, but she's very thin. You can tell she's weak right now. Weak, but still strong. She's still able to do some things because she has to keep her strength up to go through the surgery. But we're just so ready for her to be back to the normal her and get her life back and, enjoy the rest of her life that she has. And in the meantime, one thing that we had a really hard time with is I said that somebody has to die for my mom to live. And the thought of that is really, really hard to deal with. It's really hard on my mom. It's really hard on all of us. But I kept saying that to certain people, that was something that really weighed heavy on me. And I knew it weighed heavy on my parents. And my dad's sister recently came up here, Janice, and I said that to her, and she said the most perfect thing to me. She said, honey, whether your mom needs lungs or not, whoever's going to give her that amazing gift, they're going to die regardless. Because when your number is called, that's it. So, she said the best thing we can do right now is we have to pray for this person, for this donor, and pray that they know God as their Lord and Savior, first and foremost, because it's the most important thing. And secondly, to pray for their family, because they will be grieving. But we also need to be so thankful for this gift. And we truly are. And, I think that has brought my mom a little bit of peace, knowing that regardless of if she needs lungs or not, it's time for that person's number to be called. And she's going to accept this gift. And she's going to be thankful for it. And, this will be a testimony in her life. So, in the meantime, we just want everybody to know, thank you for all the prayers. Thank you for all the calls, the messages. It keeps my mom's spirits up. She's not able to see a lot of people right now or do anything she really enjoys. And just hearing from people, seeing things, it makes her happy. It brings a smile to her face. And that's really what we're trying to do, is just really keep my mom's spirits up. During this time, when she has the surgery done, she will be placed on life support during that surgery. And my mom has to be the most courageous and brave person that I know, because I don't know how she can even keep a smile on her face right now, knowing that that's what she's facing. But she is, and like I said, she is so faithful that she's going to come out so much better, and she's going to make it out of this just fine. And, it says a lot. So yeah, any encouragement you can give my mom, please, continue to pray for her. Add her to your prayer list at church if you want to. She'd be more than happy. The more people praying, the better. My dad too. Please pray for him. This is just so much on him, as much as it is on me and my brother and my sister. My dad is really, really struggling with this, but he doesn't show it to people. And I've had people ask me, time and time again, can I send them something? Can I do this? And I don't know how to go about that really and truly. Of course, they would love anything anybody wants to send them or give them. But the one thing they will never do is they will never ask for anything from anybody. But I know there's so many people out there that love my mom so much, and that my mom loves so much, and that love my dad and things like that. And we're so thankful for all those people. So I've had several people tell me, Melina, would you please start a GoFundMe for your mom? And I've been very hesitant to do that. But I've had several tell me, well, if you won't, I will, if that's okay. And I've told them, just let me think about it. So I actually told my dad, would you care, Dad, if I did this GoFundMe account for you and Mom? He was like, well, Melina, no, I would never ask anything of anybody. And I said, Dad, that's not what it is. It's, people are asking me because they want to do things for y'all or help you in any way they can to maybe ease something on you, even if that's, your dinner for the night. And these are people that love you. And after telling him that, he was like, well, I would never ask for anything like that. And I said, you don't have to ask. I'm asking you for your permission. And he told me he would be okay with me doing that. So I am going to go ahead and post a link, just like a little private link. And if there's any one of my mom's friends or family or anybody like that was wanting to do something like that, by all means, you don't have to do anything. Your prayers are enough. But if you're wanting to, it's there. Obviously, they appreciate and love anything and everything that anybody gives them or wants to give them or send to them. But like I said, first and foremost, please just keep my mom in your prayers. And I will try to continue to update you guys the best I can. I feel like half this video I've somewhat rambled in and cried throughout it all, so I appreciate if you listened to all of it, making it this far with me. It was really hard to do this video, but I hope you guys have some information now as to what's going on, and I'm happy to give any of you my phone number. My dad may not answer his phone as much, and my mom may not either, but I can give you my phone number. You can message me on Facebook. My name is Melina King on Facebook. You can message my dad, my mom, and I'll try to answer any questions I can and give any information I can out. So on behalf of my mom and dad, thank y'all for everything. Thank you for the prayers, and trust me, they feel them and they love you all.